Today, I'm going to be talking about toxoplasmosis. There are three types of toxoplasmosis: congenital toxoplasmosis, which can cause spontaneous abortion, blindness, cognitive impairment, neurological disorders, and mental retardation. Toxoplasmosis encephalitis is the second, which can cause lethargy, loss of memory, dementia, and motor seizures. As you can see to the right, there is a picture of the brain with an infection of toxoplasmosis. Third, there is ocular toxoplasmosis, which can cause retinal choroiditis, which causes lesions, uveitis, which causes inflammation inside the eye, and retinal scars. To the left, you can see the eye with the huge lesion to the right of it. Toxoplasmosis is caused by Toxoplasma gondii, which is a parasite that is facultative anaerobe, is gram-negative, crescent-shaped, has a gliding motility, and survives better in hot, humid climates and low altitudes. T. gondii's infection symptoms occur 1 to 3 weeks after exposure, which include flu-like symptoms, fever, swollen lymph nodes, and myalgia. However, most people are asymptomatic. T. gondii is contracted after eating contaminated meat or shellfish, drinking contaminated water, or even accidentally swallowing the parasite through contact with cat feces. T. gondii is transmitted 3 different ways. A. Ingestion of raw or inadequately cooked infected meat by bradyzoites. B. Ingestion of oocytes, an environmentally resistant form of the organism that cats pass in their feces, with exposure occurring through cat litter or soil. And C. A newly infected pregnant woman passing the infection to her unborn fetus by tachyzoids. As you can see here, a cat is the main source of toxoplasmosis. It can be spread straight to human, to soil and surface water, to raw vegetables to humans, from soil and surface water to plants to herbivores to humans, from herbivores to carnivores to humans, as well as herbivores to hunting animals, lions, leopards. T. gondii pathogenesis starts by T. gondii being ingested from infected meat and water by tissue cysts or by oocytes from cat feces. Bradyzoites or oocytes transform into tachyzoites. Tachyzoites invade neurons and muscle tissue, developing into bradiocytes, penetrating intestinal epithelium, multiplying in intestines, spreading to lymphatics and blood, causing disease and symptoms such as flu, swollen lymph nodes, and myalgia. As you can see here, fecal oocytes are transmitted to humans, or tissue sites are transmitted to humans, and even fetus. Oocytes mostly come from cat feces. Tissue cysts come from animals. When we talk about T. gondii virulence factors, we look at how they form endospores as well as the proteins they use. The first one includes ROP16, which promotes M2 programs, which are macrophages that secrete anti-inflammatory molecules that can downregulate helper T cells, which limits the magnitude of parasite-specific T cell responses. ROP18 phosphorylates host immune-related GTPase, IRGs, and prevents them from accumulating on the membrane and destroying the parasite vacuole. However, T. gondii can have a complication such as necrosis, which happens after T. gondii spreads to blood and lymphatics. Tachyocytes can multiply in great numbers, causing necrosis. As you can see, Grade 0 is the regular stomach epithelium. And grade 1, 2, 3, and 4 shows how necrosis can accelerate or get worse over time. T. gondii can be prevented by such ways: washing hands with soap and water, wearing gloves when gardening and changing cat litter, feeding cats only canned or dried commercial food, or well-cooked table food, which is not raw or undercooked meats, as well as ensuring that the cat litter box is changed daily. T. gondii's prevention for foods include cooking food to safe temperatures, freezing meat for several days at sub-zero temperatures before cooking to greatly reduce chance of infection, peeling or washing fruits and vegetables thoroughly before eating, washing cutting boards, dishes, counters, utensils after contact with raw meat, poultry, seafood, or unwashed fruits and vegetables, not drinking unpasteurized goat's milk and untreated water, as well as not eating raw or uncooked oysters, mussels, or clams. T. gondii treatment for non-pregnant people can be treated with a combination of drugs, such as pyrimethamine and sulfadiazine, plus folinic acid. As you can see, sulfadiazine can be tablets. T. gondii's treatment for pregnant women is the same as non-pregnant women. However, the parasite is not eliminated completely. The parasite can remain within tissue cells in a less active phase, where their location makes it difficult for the medication to completely eliminate them. For treatment with people with ocular toxoplasmosis, they are prescribed medicine to treat active disease by their ophthalmologist. Whether or not medication is recommended depends on the size of their eye lesion, the location, and the characteristics of the lesion, which can be acute active versus chronic not progressing. People with compromised immune systems need to be treated until they have improvement in their condition. Such as people with AIDS, it may be necessary to continue medication for the rest of their lives or for as long as they are immunosuppressed. That is the end of toxoplasmosis.